Welcome to Therapy Tips with me, ChadGOrthoOT. I hope you enjoy the video.
Why sometimes do we just develop this shoulder pain where we've not done anything, we've not done any kind of straining, any kind of excessive work, it's just began to hurt and now it's just continuing on, and now the shoulder's really throbbing and we have pain going in our neck, pain going down your arm and your hand. So I'm going to show you something that's very common that happens to a lot of people. So we have 4 rotator cuff muscles. Those rotator cuff muscles originate from our scapula, our shoulder blade, and they come over and attach the small portion of the humerus bone, our upper arm bone, the bone from the shoulder to the elbow. And so what can happen, sometimes for no rhyme or reason, just becoming weak. As we become older and more inactive, these rotator cuff muscles become weak and they lose some of their function and their ability to adequately decompress the humeral head. Now what that is, the humeral head, or the head of the humerus, will want to ride up into the shoulder joint as we're moving our arm, raising it up in front, raising it out to the side, etc. And so the counterbalance for that, or the counterforce for that, are these 4 rotator cuff muscles kind of working in concert to pull that ball down and keep it more centralized within the joint space. And so over time, as these muscles become weak, then we start to get this little riding up, or what's called superior upward migration of this ball into the socket, and that starts to rub and irritate the tendons of the rotator cuff. And then that develops into a rotator cuff tendon pathology. That's where you get this irritation, this pain. Sometimes if we have spurs here, we start to get this rubbing sensation or this friction, and then we can have fraying of the tendons. So sometimes there may be no rhyme or reason as to why this occurred, other than it just become weak and it's not functioning properly, and then that's what causes a lot of your rotator cuff pain or dysfunction when there's no traumatic event that caused that. So this is a very treatable condition with therapy intervention, and it does not require surgery in a lot of the cases if it's caught early enough. Thank you so much for watching this video, and I hope it helps.